Greetings to all. We are in another intergenerational meeting, as we usually do on 10th of each month. Today we are planning to talk about future of seed. We have some advisors, and we are hoping to find to have others as well. And we have our young friends with us. I hope it will be, although we may not have too many friends here, we will have a possibility to watch on YouTube later. Recently, Rodrigo Ramalha had prepared a mini survey for our members about the ideas, about the opinions for future, what we can do, and what attracted them to this group. Ramina Pro has the results, and he will summarize them. On this occasion, let me say hello to David Barron and Rachel Jenkins and Madeline, Tena, Miraj. Asan, I think, is listening to us, similar to Ece. Ramin, may I leave the floor for you? Then we will have other friends to contribute as well, of course. Please, Ramin.
Okay, thank you, Dr. Choshkun. All right, so just give me a moment to share my screen. All right, can everyone see this?
Yeah, we can.
All right. Okay, so as Dr. Choshkun has mentioned, Dr. Rodrigo has actually come up with a survey for our members, and there were basically 3 questions that were asked. We have sort of summarized it, and the way we are going to present it today is by dividing it according to the questions, because there were 13 responses in total, but not all the questions were answered by everyone, if you get the flow, you know. So let's just go right into it. All right. So the first question that we asked our members was, what attracted you to the group? So I decided to divide it into these 4 main categories of reasons that were provided by our respondents. So as you can see, the most number of our members actually mentioned that they joined because of the like-mindedness, the idea of having a like-mindedness when joining and participating in our seed activities. Another, maybe the second majority would be those who are interested in exploring psychiatry within this seed group. And there were 2 people who mentioned the opportunity to perform research, and as well as there was 1 response about policy making as well. So let me just share with you an excerpt of one of the respondents. I would like to collaborate with my international colleagues. As a medical student, I would like to make policy papers. So of course, everything is anonymous. So I think none of us know who actually mentioned this, but I think this is an interesting point to be brought up. And I think I can see Professor Jenkins is very excited about this, about the mention of policy papers. So maybe we can discuss about this first question first, about the response of our members.
You mean, excuse me for interrupting, you mean we will, are you suggesting us to discuss on the findings, Rami?
Yep. Yeah, I think it may have value for us to discuss on these findings.
Yeah.
And yeah, maybe we can get more insight about our members as well.
When he or she mentions about policy papers, I have noted our dear Professor Jenkins has a smiling face. She may want to say a few words. She's a master in policy making about mental health issues.
No, well, I was just laughing because I think it's nice that a medical student would be interested in policy, but in terms of doing policy, you need a lot of experience of kind of being a clinician, running a service, supporting a country, as it were. There's so much to kind of know and understand, and so the idea that a medical student, I was laughing really, the idea that a medical student would make policy would be a bit worrisome, really, until they had more experience. But medical students do like to make policy. They like to make policy about what they're, how they're taught, what their exams should consist of, how the exam should run. So yeah, medical students are certainly very assertive in lots of ways. It'd be interesting to talk to them about, yes, what they had in mind.
But I think it's so important that they have this in mind. I'm wondering at what age you had thought of getting involved with policy making.
I was kind of hijacked into our Ministry of Health when I was in my 40s, I suppose, when so I'd been a clinician, a researcher, and I'd been a consultant and senior lecturer at Barts before that, I suppose. So I'd run a service for the City of London. And then I had to learn on the job. Nobody taught me. You had to learn as you were doing it. So I'm all for people learning about policy. But the idea of making policy as a medical student sort of rather frightens me, really. You know, it's like giving the 2-year-old the car keys.
Well, could we understand that getting involved with policy making?
Yes.
Similar to you, you may recall that I was also working in the Ministry of Health. When I was invited to be the director of mental health department at the Ministry of Health, I had, I said, no, I'm working at the dispensary. I have a lot to do at the clinical work, but not hijacked. But at the end, I was told by the general director that you will be working about the whole country. So it's much more important. I believed in that and went to the Ministry of Health. Well, whatever I have done, I don't know, but I was involved with that about the age of 35 or something like that. Anyway, what would you say, David? You also have a lot to say probably on this issue.
So my story is very similar to all yours. I got recruited back to NIMH to be the deputy clinical director. I was in my early mid-30s, and I had run a psycho-oncology service. I had been a director of medical education. I had been a consultant to Los Angeles County Mental Health, which is I think it's the largest in the world. So I had learned a lot, and what I had seen in this generation of medical students, particularly in the U.S., I can't speak for other countries, but the students are much, I don't want to use entitled because that's maybe the wrong word, but I think they're like when the Black Lives Matters issue came up, the students took a very strong leadership role, which I thought was good. But one of the things I thought wasn't so good is they were wanting to lecture to the faculty as if they knew more than, and I lived through the 60s and 70s when the race riots were going on. So it's just, they just don't have the experience yet. And one of the things that I would recommend, and I think it's similar to what we've just heard, is to say it's very important that psychiatrists and clinicians should be engaged in discussions about policy, because that's very important. But I would use the analogy: would a student want to then go in and say, well, I'm going to be a neurosurgeon and I'm going to do a very intricate brain surgery when I'm still a medical student? At some point, yes, you might be able, if you get training and experience, but I think most students would probably say, okay, well, here's a patient that's going, and they've got a lesion on their brain. We want you to go in and extract that lesion. That I think using something that they can relate to, that, it's important that they get involved, and it's important to hear their opinion. And then that in developing policy, it takes probably a good policymaker brings a good team around them. So I think the perspective of a medical student, of the future generation, is really important. But I think it would also be important for them to understand that policy has a lot of nuance to it. It takes a lot of experience. It takes skills that usually one doesn't get in medical school. It's something that either you're lucky enough to mentor, or you just learn by making mistakes as you go along. And so I guess my idea is to encourage them to feel that their voice is one that needs to be heard, and that those of them who think they might want to have a career in that area, this is kind of almost like a career choice, that they might want to mentor and some of the things they could do. So not discourage them, but give them a more realistic appreciation that policy, when you talk about people who are making policy, there's usually, if you're going to do it well, it requires lots of mentoring, just like to become a good surgeon or a good psychotherapist. That's why you spend a lot of years going to medical school and going to residency and then going to fellowship. And policy is even beyond that. So maybe to frame it in a way to not dampen their enthusiasm, but make sure that they have a realistic expectation of what it takes, but yet they still have a role even as a student. But the role maybe wouldn't be making policy, but contributing to policymakers to make sure that their perspective is one that's heard.
Thank you very much. And thank you, Ramin, for having us seeing one another. Well, we have our younger colleagues, Madeleine, Miraj, Ece, although we don't see some of you because you don't put your cameras on. And of course, Ramin, what are your thoughts?
Yeah, I would actually like to share something. I mean, I guess this, the sharing by one of our members about wanting to make policy and all that, I think it's a sign that we should probably have a few sessions on probably policy making, and to get us students probably more accustomed to it, or to probably realize the flow of it. Because as we can see from the posting by the respondent, it's clear that they have the passion to make a difference in the world, but they are not aware of the intricacies and the delicate process which needs to be done in order to come up with a policy paper, and the years and years of experience that is necessary. So probably one of the things we could consider organizing in the future as well would be something regarding policy making, probably, if that is something that interests the whole group, of course. But yeah, apart from that, we also saw things about research opportunities, which we have thrown about every once in a while, but there has never been any concrete ideas or plans for us to actually partake in a global research, as far as I'm aware.
I think there's two, I'd be all for, seeing what we could teach. I think there's two steps before policy, really. One is to make sure they really understand about epidemiology. Right. And the other is to understand about situation appraisals, how to really understand the context and the way the system is working and so on. So So those would be my two main kind of building blocks, really. And then when you've got your head around that, you can start thinking about how you would tinker with the system.
Yeah. Management issues, administrative issues. We don't even have usual training in residency programs about this, I'm afraid. So medical students may have some idea about what is mental health programming, mental health services, what is it about, how it is planned. And yeah, these maybe thanks to that young colleague. So he or she made us discuss these. Madeleine, would you like to say a few words on this?
Sure. I am a medical student. I'm one of Dr. Barron's students. Unfortunately, I don't have a lot of perspective on policymaking. I really haven't started learning about it, and I haven't started exploring it yet. It's interesting listening to your perspectives on it, and what's involved within it, and what students should be looking to try to do. I think it's a good idea to try to educate students. I think it's something I would be very interested in further on the line to try to learn about. Yeah, I think it'd be great.
I believe the students could actually teach us something as well. And what they could teach is really, I'm not saying this because you're wrong, but the students have the perspective of what drives their generation. So maybe the role of social media in policymaking. I think this is a real opportunity where we could share our experience, and that it does take time. But I also believe that the students have an opportunity to share a perspective, and certainly that IT gap we talk about, that would be important. So I really believe working together, moving forward, hearing what, how does this generation and the generation behind them, how does policy affect them? Is policy something that means something, or are they so jaded that they think everything is alike? I mean, I think the perspective of not only you as a student, but of your generation and the ones that you're closer to would make it, I think the final product would be a better one if we all work together and listen to each other from the perspective. But I think it's important to understand that policy, there's a history to it, but there's also what's going to be the future of dealing with policy. I mean, we see how economics have affected so much. The geopolitical scene is affecting health and mental health policy. So I believe, to me, this was a good thing that students want to get involved, but then understand how we can work together, how we as more senior people can learn from you, how we can share what we've learned, and together we come up with a product that's best for public health. And policy, we're not really doing with individual patients, really more with public health. Even something as simple as, how do you get the public to buy into a policy? How do you get them to understand? Because again, we talk a lot about it's not what we teach; it's what our students, whoever they might be, what they learn. So, Rachel, we've all been involved with public health policy, and smoking is probably the best example. What are we, 60, 70 years? We knew that smoking wasn't particularly good, yet what finally helped us to turn the corner a bit and cutting back on it was really more than just the scientific facts, but dealing with policy about, getting smoking out of movies. And, there's a whole host of things. So I believe there's something we could learn from each other. And hopefully that engagement with the students would be something that we could all walk away saying we're better because we interacted together.
I fully agree with you. We have a lot to learn from each other, and especially the younger generation. Maybe taking time into consideration, we may continue with your presentation. Ramin, would you help us?
Sure.
Thank you.
All right. So I guess we can move on to the next question, which was asked, which was, what is something you would like to see happening in the group For example, what kind of activities would you like to see? So it's a more of an open-ended question. So we got a lot of responses, and some respondents, some of our members even gave a few suggestions. So I've just listed them all and removed the redundants. So the most commonly requested thing that our members do want to see is research or poster presentation or journal publication of some sort. Another thing was collaborations with other fields of medicine. I believe there was a suggestion for those who, the fields of medicine that seem really distant from psychiatry. So, so we can see how mental health and psychiatry sort of is affected in all the fields of medicine and not just within the field of psychiatry itself. And of course, policy papers writing, as we have discussed. Some of the other more interesting suggestions were student-to-student meetings, teachings or sharings from our senior psychiatrists, scientific discussions related to psychiatry. So I'm guessing more along the lines of maybe advances in our treatment modalities, about newly developed therapies. And apart from that, there was a suggestion to expand the IGM audience by advertising more to directly to each or to as many medical schools or departments as we can. I believe we have tried to reach out, but probably what this suggestion is referring to is a more direct approach, possibly. And similar to what Professor Barron has mentioned earlier, there was a suggestion to divide into smaller groups and organize some projects virtually. So that's interesting. And the other suggestion was to increase our visibility on social media. So I guess that's more along the lines of maybe posting things more regularly and to keep up our social media appearances, because currently we only post on our social media when we're announcing our intergenerational meetings or when we are talking about World Mental Health Day. So I think that was one of the suggestions that was listed. So before I move on to an excerpt of one of our members, does anyone have any comments about this?
Just a quick comment. One of the things that I think a lot of students are looking for, and I think it's totally legitimate, is ways to not only engage with people who are interested in this, but to improve their CVs for residency status. It's become very competitive in the U.S. And again, I can't speak as much with our international students, but in the U.S., psychiatry, I'm thrilled to see, has become a really a very competitive residency to get. For years it had dropped down, but now it's coming up, and the students are really looking for not just to put another notch on their academic belt. I think they really do want to learn, but they really need to get something for their efforts, whether it's a paper or publication. So when they do their residency application, it's something that will allow them to get into the field. And that's why I was thinking subgroups with projects we can do. We've done that one study looking at concussion education, a survey that a number of our Western U students are still involved with. We're expanding that internationally. So I think we do have to keep in mind, we need to have something that's product oriented, that there's something that they can show. I think, they're very, very busy trying to learn their trade as they go through medical school. But I think we have to be cognizant that we have to assist them in having something that will be of benefit for them, beyond just the social and the didactic piece of interacting with other interested, but something that they can get on their CV that they can maybe give them a leg up. And I would defer to the students if I'm wrong on that, but.
Okay.
I would agree with you. I mean, it's definitely something that unfortunately students have to be aware of going into residency, that we have to try to build up our application, try to make ourselves stand out for something that we really want. And, this group could definitely be a way I think students think of trying to make themselves stand out and contribute.
I think it absolutely can. And I don't think there's anything the matter with that. I think, students, their time is very precious and valuable. And I think to show that, they're interacting at an international level, that we get some projects, that maybe we could get some posters at WPA meetings, that, that we could have, every student who was involved could get, authorship, as long as they were, it was appropriate. They have to make a contribution. But I think for those of us on the call who are more senior, at this stage of our careers, our primary goal is to assist and to mentor the next generation. None of us are looking at, we don't need to be first authors anymore. We've kind of been there, done that. But we certainly want to at least, and I know for the three of us on the call tonight, the reason we're on the call is we're committed and very passionate about helping to train that next generation in their careers the way we were all given opportunities early on in our careers.
I would like to say only a small point. I would like to underline what David says, product-oriented. That's indeed a very important point. And for subgroups or other activities, he is not with us now, but Dr. Sartorius has suggested some ideas, some opinions. After Ramin's presentation, I would like to mention a few things about that. Yeah, please, Ramin. You still have a few more things to share?
Yes. I believe Dr. Ahsan wanted to say something earlier, but...
He's here, but...
Thank you, Rami. I just keep on. I am actually driving to the airport, now back to the airport, and I'm just like, keep on turning the microphone on and off. No, I think this is a wonderful discussion, really. And I agree what was said before about the policies and about the projects. And I think one of the things that I'm seeing is a common thread is that the students who are participating in the group, they want something concrete coming out of the group, something that what Dr. Dave said, like something that they can put on the CV, that this is a project that they work on. And I think that's exactly what the medical student said about the policy. I honestly don't think that he is asking for be an author on the policy making, because policy is on a very specific topic in a very specific geographical area. But what he is looking for is probably some type of experience. Maybe that will help him go to a public health or something. I don't know what his plans are in the future. But I really think that we should figure out, I think that what Dr. Dave says about the making the poster presentations in the WPA, the submission date is still, I think, a couple of months in the future. That's going to be a very good idea. One of the things I was thinking about is that we all can write something about the education of psychiatry in the medical schools where we work, and we can compile all that information, and it can turn out to be a really good paper that can be supported by our committee. So anything, I think, that in which we don't have to put a lot of effort in, but the end result will be good, and medical students can see something on their CVs, I think will be worthwhile.
Thank you very much, Ahsan.
Yeah, I can see that's very helpful, Ahsan. And I can see the value of our medical students coming together to write something about what they think should go in the psychiatry curriculum as a medical student that will help them in the future, whatever path they choose. Whether it isn't just to become psychiatrists, although obviously we all think that's important, but also people who might go into primary care, people who might go into public health, whatever field they go in, they need a strong mental health understanding and epidemiological understanding, and indeed policy understanding. And often the curriculum isn't supplying that for medical students. So we have people in later life, in primary care, public health, who don't know the psychiatry they need to do their job properly.
Yeah. Rachel, I think it's even worse than that. I think it's what we're teaching now in not all but many programs is really has little relevance for the primary care physician. I know one of the things that I did when I was at Temple, when I was chair of the department many moons ago there, the psych course was very poorly attended and very poor. So I literally changed the name from the introduction to psychiatry to the role of psychiatry in general medicine. Mm-hmm. And just changing the name had a difference, because I think, for too many years, we've taught what we were taught, core psychopathology and kind of what you would learn if you did a psych residency. And I know the three of us have all really dedicated our lives to interacting with our non-psychiatric physician colleagues, particularly psychiatry and primary care. So I think there are some schools that are getting towards that. But I think that the students' perspective, or even recent grads who've been through, maybe we get some, early career in primary care and say, I really wish I would have learned more about how to diagnose and treat depression or sleep disorders, or, how do I differentiate symptoms from syndromes, and when do I appropriately refer? So I think changing the focus from kind of an introduction to psychiatry, as if you're going to become a psychiatrist, to the role of mental health and psychiatric medicine for the non-psychiatric physician, particularly the primary care physician.
Yeah, that's absolutely right. When I first got to Barts and I was asked to teach the medical students, I looked at their curriculum and discovered they had 2 hours on Klinefelter's syndrome and nothing on depression and anxiety.
Getting back to understanding epidemiology, which one is more epidemiologically relevant, right? Or substance abuse. I mean, there's so many issues, substance abuse. So, I think the seed group could be one that could take, could take a role. We could publish some, from the perspective of, this is going to be my career. So I think there are wonderful opportunities, but I think we do have to focus on a deliverable, something that they can get their name on. I'm telling my students that they should absolutely put on their CVs that they're a member of an international group that meets monthly and goes, we do webinars and we do all these things. So that in and of itself, I think, is worthy. But I know I do work with the Caucus of Global Mental Health for the APA. And the one thing I've tried to do in my 2 years as chair of that, I said, we have to be product oriented. So we've actually created subgroups. So we've had more products in the last 2 years than the prior entire history of the caucus, because they'd sit around and talk, but never did anything. So I think that people want to see something in return for their time, as time has become so precious. So I think we can learn from that and create a deliverable, and my thought would be maybe have some smaller work groups so people could work asynchronously offline when they have time. And then we could come together as a whole group, the way Boulant and I have tried to do with our section on psychiatry, medicine, and primary care.
Well, I couldn't agree more on that point, and I would like to say something. So as far as I understand, we as a students, I mean, I'm not a student anymore, but for students, they would like to make a policy like we on their education, as we get the responses from the survey. And they would like to make something concrete. I really agree that the time is precious and we're applying for residency or some other stuff, but we need to contribute to our CV while spending time on that. So we might build a project team that's working on this primary education toward shifting it towards primary care, making psychiatry clerkship a bit more practical for primary care. Like Professor David Barron said, it might focus on substance abuse, like symptom and disorder difference, and depression, sleep disorders. I think that's also one. I need to get more. I would like to treat sleep disorders very well, because what we need in primary care is that I'm now working on a primary care unit. So I would like to be more confident on sleep disorders and how to treat them. I think what a primary care physician needs are those. So I think we might make a policy view. I mean, like a view on how the primary medical education, how the medical education should be in case for psychiatry. I think we can like work on a project like that. We can write a view or a view on policies on medical education. We might like start a project group in SEED. I don't know. What do you think all the other friends from student point of view thinks about that? We might ask other students in SEED group as well.
Great ideas.
Okay.
We are all, by the way, we are all students, Miraj. I mean, you may have finished the school, but we continue learning from each other.
Definitely. Maybe I should say I'm not a medical student anymore. So I already completed my clerkship, but I can contribute as a primary physician. I don't know.
Sure. Yeah, Ramin, please.
Yeah, in the interest of time, I think we can move forward. Yeah, so one of the excerpts that I just wanted to share was this one. Yeah. Actually, doing teamwork is difficult to manage, and I guess we have some problems related to that. In order to make things done and happen, we need to be organized and disciplined, although it is a voluntary job. Without that, I guess no work will get done. So this has been something that we have been facing, I guess, with regards to attendance to our IGMs and basically all our meetings in general. So I guess we're all still learning how to overcome these issues that we are having, and I think it's multifactorial actually, because it can be due to timing, it can be due to language barriers. There's a lot of factors that go into issues with contributing to our SEED working group as well. So yeah, I think it's just something that I wanted to highlight for us to reflect on, and perhaps we can come up with something during our next meeting. Yeah. So the final question that was asked was, how would you like to contribute to the group, either individually or with the other colleagues? So generally, there are some responses which are about their suggestions on how they can contribute, and there were other responses who actually mentioned that they are interested to contribute. However, due to certain difficulties, they are unable to contribute. So we'll explore both of them. So first of all, some of the things that our respondents, our members would like to contribute is by helping to lead and organize certain campaigns, collaborate in research, recommending new activities, for example, learning about policy making, I suppose, being more active in meetings, leading meetings. There were some who volunteered to reach out to new speakers for our intergenerational meetings, or guest speakers, I suppose. There are some who opted to be more of a passive listener or a voter who would just share their opinions within our SEED group itself. And there are some who are open to suggestions as to how they may contribute. So another thing that we found was there are some of our members who have difficulty in joining meetings because of they are currently in a difficult shift or rotation. They are currently moving on to residency. The timing is not right for them, or they are getting busy during their next term of studies. So I think these are very interesting responses that we got for these. And I would I'm actually interested into how we can tackle the how we can aid our members who are facing difficulty in joining meetings, because they very obviously have the interest and the passion to be part of our meetings and be part of our discussions, but due to certain circumstances, they are unable to. So I think this is something that we've been probably facing probably since the beginning as well. And it's no surprise because we're an international group. So I think there were suggestions with regards to the timing. There were suggestions of alternating the timings. We did try that for some of the intergenerational meetings as well. But the results were mixed in general. So I think it's a very difficult issue for us to handle.
And this is actually no different than running a meeting like when Bulat and I with our section, I'm sure Rachel has had this, whether you're a student or you're a busy clinician. I mean, these are international projects. These are in fact the issues that we run into all the time. Whether it's, trying to get a sectional meeting. And I think that's one of the challenges that might be even do it. How do we create an environment where we can achieve these? Because it's not just for students. I mean, if we can come up with this, with some reasonable, suggestions or ways to deal with it, it would have relevance for a lot. For senior, middle, it's really, in the entire field. So I think these are really important questions that are not unique, and that maybe just discussions, is it just flipping the time? Is it trying to figure out how to do it asynchronously? I mean, but I think this is going to be the challenge moving forward with international meetings, when we now learn that you don't have to get face-to-face to have one. Not that many years ago, if you want to have an international meeting, either you're on the telephone, or maybe you were emailing, or you were all waiting to the next international congress where you could get together. Now, post-COVID, people have relied on Zoom and Teams and, all the different, but I think we're still trying to figure out how to best utilize these. So again, I would be very interested in hearing the students' perspective and some of our early, early students, later students, but then, the senior members, we can share the way it was in the good old or the bad old days, but we need to come up with what will work moving forward. How can we learn from each other to address these very important issues?
Dr. Burnett, I just want to say a few words because I have to leave in a few minutes. I honestly think that this discussion had been really, really productive. I think this is the after a long time that we are finding some of the core opportunities to move forward, and I think this is really fruitful. Couple of things I think that we should start thinking about is that we have come a long way, and how we are going to make the presence more on the social media. I think that was one of the suggestions, so that we can broaden our group. The second thing is that how we can structure our meetings. Maybe we can add journal club in one. Maybe we can add international presentation in the other. Maybe we can ask medical students to talk about some of the important areas, important topics that are that they want to learn more in their areas, or maybe on a global basis. So I think there are wonderful opportunities. I just want to say one thing before I leave, is that our heart and our prayers go to all the people of Turkey and Syria, and it was very sad. And I hope that all the people and the medical students who are over there, they are safe, and their families and loved ones are safe. So I just want to convey my wishes, and let's keep on moving forward. Thank you so much for letting me join today.
Thank you, Hassan. Thank you very much. And thank you for joining on your way to the airport. And thank you for your good wishes. Ramin, do you have anything else to say?
There were a few final comments. I'll just briefly go through it. So there was a respondent who mentioned that as I will be moving on to residency and have more commitments, I think I can contribute more by mentoring students as an ECP. I believe ECP would be early career psychiatrist or early career physician. So
Yes.
yeah. So yeah, that's one of the good news that we have for I guess a new junior senior member, I guess, in a way. Apart from that, there are some comments about still exploring my individual interests within mental health and would be excited to explore anything. I've been unable to attend the last few meetings due to time differences, as we've discussed, and rotation schedule. I would like to know if it's feasible to have earlier meeting times. So yeah, as we have discussed, I guess this is something that we can probably reflect on and take our time to see if we can do something about it. This next one is a bit lengthy, so bear with me for a moment. I have to say I've been quite inactive for a while now in the SEED group. This is because I've been considering some other specialties and have moved my attention away from psychiatry recently, as one's time is limited. But I would like to remain in the group chat because mental health is important in any specialties one goes in, and who knows, I might end up being a psychiatrist at the end. I found this was interesting because I did not think of personally, I did not think of the SEED group as a psychiatry-centric group. I considered it as a group to promote awareness and have a student-centered activities surrounding mental health awareness. So, but I can see that this person does acknowledge that mental health is important in any specialty. So I believe that this person may have had a slightly inaccurate expectation of the group, possibly. But I'm glad that they decided to stay within the group, and although they are inactive, they are willing to admit that mental health is important in their future, regardless of the specialty they pursue. Yeah, apart from that, there were a lot of messages of thanks. Thanks for putting this together. Hope we may gain more insight into our members. Thanks for everything. Thank you for this opportunity, and keep going, SEED. So yeah, that's basically what we gathered from the survey. That's what I've managed to summarize. As you can tell, some of the questions were answered by all the respondents, and some were left blank. But I do believe we managed to gain a little bit more insight into our members. And yeah, do we have any comments about these?
I would first like to say thank you a lot for summarizing all those answers, Ramin, and also your last comment about what the young friend said. Yes, there is a difference between mental health and psychiatry, but thanks to that friend as well. So he or she made us talk about this, underline this. Before going to what Dr. Sartorius has suggested, I want to say a few words about that, but maybe again, our participants may have some last comments about the survey, mini survey.
Can I ask about how many members we've got of SEED? How many? What sort of population are we talking about?
Yeah. Immediately, I will tell you. Well, it takes time for me to see that. Sorry.
Just a general order, of magnitude.
Yeah. Well, there are some participants. Well, we have 50 participants in our group, but some have been silent for a long time. So number of participants for this mini survey is not bad for me, I think, but you are an epidemiologist, you know much better.
There is the question of, yes, how representative are the people who've answered? But yeah, I was more interested in how big the group of medical students is that we're supporting. Yeah. And,
these are not all medical students. It includes some early career psychiatrists, some graduates, and me, David, and so Eugene, Rodrigo. We have to make an arrangement about the real medical student number. If we take that into consideration, that may be about 35 or something like that.
Yes, it kind of has relevance if we're being asked to mentor or run a small group or something. Yes, just what's the best way of deploying the senior expertise? I suppose that's what I'm thinking about. But we don't have to solve that now. It was just a question to work through.
Thank you. You have underlined this, and I believe at least some of us will go over it at the YouTube recording.
I have to go in 5 minutes, I'm afraid.
Okay. If David and other friends don't have much to say, let me share what Dr. Sartorius has sent us. He had suggested, I think you see this, yeah. He suggested 4 different activities. One of the participants presents an outline of his or her project, and the advisors give their opinion. We had some decrease in the participant advisors' participation as well. So 2 advisors might be good for this suggestion, he says. And a talk on specific subject given by one of those present medical students present would select a topic on which a senior would speak for 30 minutes with a discussion to follow. It might be an activity to be carried together with an advisor, a talk on a subject, specific subject. And the third suggestion, one of the students presents a talk on a subject of their choice. If there are more than one proposals, the students would select the most interesting one. There could be more than one advisors. And his last suggestion was about the students selecting one of the advisors and asking him any question that comes to their mind, together with, of course, one advisor. And in line with the last one, we have decided to have on the coming days, on 24th of February, we're going to have a session with Dr. Sartorius where he will be answering the questions of the students, especially about psychiatry in general and the role of psychiatry and public health working together. So I have announced it in SEED group as well. He agrees that we could invite some early career psychiatrists to this discussion, to this session with, or conversation with Professor Sartorius. These are his suggestions. Before you leave, would you like to add or underline any of them, Rachel? We could have maybe you as another senior person discussing with students. And lastly, I would like to underline this as well, for how to prepare a project proposal. I think we have discussed with David. He could spare some time about, he could give us a presentation about how to prepare project proposals. After that, students, either alone or with small groups, could share their views about projects.
I think they're very good suggestions, extremely good suggestions. So we could see which format the students found most valuable if we try them all out, you know. I think the ones where the students do the presentation, do the work, as it were, is a good plan to get more active involvement. Yeah, I'd support that, and then the advisors comment and make suggestions, because that will kind of help them in their normal arenas as well. But yes, I think that's Prof. Sartorius has mapped a good way forward for the group. I think that's it on my part. Thank you. Thank you very much for including me. Yeah.
Good to see you, Rachel. Be well.
Pleased to be together with you.
Yeah.
Thank you.
Well, you too. Bye.
Would you agree with what Dr. Sartorius says, David? May I ask you?
Yeah, no, I think, no, you know, Norman has done this for a very long time, very successfully, and you know, I would agree with him. I think the students, we need to, if we're going to keep this going, we need to allow the students to feel like they're more actively engaged. They hear enough lectures during the course of their medical education. They don't need to hear another lecture. I think having them be in the position to share their thoughts, what they want, need, have the students feel much more active. I think, you know, the getting the groups, I think he has some very specific ideas that I think what I would do is I would take his ideas back to the students and say, what do they think about them? Because he and I are of the, I mean, he's a bit older than I am, but we're all that same kind of generation. We were trained in the same way. I mean, I certainly agree with them, but I guess my suggestion or recommendation would be, let's take these back to the students and see if they agree or how they want to modify them or add them. I think if we're going to say we want the students to be engaged, we have to kind of, as we say in the States, walk the walk and talk the talk. So I think Professor Sartorius, you know, many of the students probably don't know how distinguished he was. You know, he ran mental health for the WHO with 20 years. I mean, he has been a giant, an absolute giant in the field. Few people have done more in the area of public mental health. But, you know, I still think what I'd like to do is take it back to the students and see how they respond to it. And then we collectively come together and say, okay, this sounds good. How are we going to do this? Let's maybe put in some submissions for the WPA meeting in Vienna, where even if people can't attend the meeting, they could maybe contribute and be listed on a poster or a paper or a project. I think allowing the students to pick an area, small subgroups that maybe not everyone's interested in public policy. Maybe they're more interested in, you know, mental health and primary care, whatever it might be. So let's see what they're interested in and maybe develop subgroups or working groups that they can, and then define and what we can do as senior leaders is help develop the projects and use whatever influence or expertise we might have to make sure that we work as mentoring the students, not doing it for them. They don't want that. They want to do it, but to mentor them and to help them achieve the goals that we all want.
Thank you very much. Yeah, we should share this there. Before coming to the end of this meeting, we have Madeline and Miraj and Ramin. Ajay is not in a proper place to share her views, but she has followed the meeting. Miraç, do you have anything else to say?
Well, I also really like the suggestions that Professor Norman Sartorius made. But I would like to underline the first suggestion. I really like that, actually, the one that students present their projects or project proposals and give advice on advisors. I think this is a great opportunity for students. I mean, getting advice from our advisors and professors. I think this is a great opportunity. And you mentioned about that we might learn how to make project proposals and prepare our own one and get advice on that. I think this is also a great opportunity, and one might apply some grants. There are many grants given to student project on national and international basis. I think it might open a way to those as well. So I think this is a great opportunity for students and great idea. I really like that one.
Thank you. Oh, excuse me. I shot a wrong sorry. Would you like to share your experiences in how to prepare project proposals, David, in the coming days?
Sure. I mean, we could do, again, I'm happy to do that. What I want to try to avoid is make it another lecture. I think students get sick of hearing that. I'm happy to share.
Short one.
It's a process. It's a team. We can go in that. What I'd really like to do is maybe ask the students, what are some projects that they like? And then I could share. I say, well, people think survey studies are very simple. They're not simple. I mean, a good survey study is actually quite difficult. Coming up with a survey is a whole lot more than just asking a few questions. There are so many, and I learned this, from people who taught me. I thought, well, you just ask a bunch of questions. No, that's so. What I'd like to do, I'm more than happy to talk about putting it together. But I guess what I'd like to do is make sure that we are engaging the students to have them take the lead and say, what are some projects that you think you might be interested in doing? And then I can highlight how to get them started, how we can truly be mentors. Because I'm afraid if I could do a lecture on how do you put together an R01 grant? How do you, we're working with this on this section, how do we submit, various grants to governments or to industry or to whatever. I think maybe down the road, what I'd like to do for the consideration of the group is to ask them what projects they might be interested in. And then we could give some advice on how you start the process, but have them be very active, engaged, and really have them take the lead on talking about things they're interested in. And then maybe mentor them to guide them in a way that they really make sure they're getting something out of it, but that they're active and taking a lead role.
Let's find a good title for that. And you, together with some students who are interested in proposing projects, may have this interactive session, maybe in our next intergenerational meeting. Does that sound reasonable?
Oh, yeah, for sure. In fact, so a number of my students, Western U Comp students, Comp Northwest, particularly in our Northwest campus, is mainly we're doing a lot of Zoom stuff now, but I'm going to be going up there and meeting with. We had almost a third of the class got onto a call just because they're interested in research. So there's a lot of interest. What I want to do is go up there and listen to the students. We have some potential projects, but hear what do they want to get involved with, and really make sure that they know if they're willing to put the time in, they're going to get something out of it. And it's part of a process and it's part of the mentorship. But I'm very excited to get. We're looking at some potential projects with the Native American population up in Oregon, which is near one of our campuses up there. So there's a lot of opportunities. But rather than say, well, this is what we're going to do, I want to go to the students and say, what are you interested in? Here's a possibility, but what would you like to do? And how can we work together? Because then I can help them put together a grant or a way to get funding or just to get a study going. Maybe we're not going to get funding from it. I mean, for the American Osteopathic Association in the US, I sit on their National Research Advisory Board. So there's ways to get small amount of money to get some projects going. So I think that's a process that I believe might address some of the issues that were brought up in in the questionnaire today, which I thought was very telling. And thank you for sharing that with all of us.
Before closing, Ramin and Madeline, do you have anything else to say?
Probably just my concern is the attendance for the meeting with Professor Sartorius. So perhaps what we could do is probably a week before the meeting, we could gauge the number of participants who will be attending, just to make sure that we have a reasonable number of students participating.
Let's work on that. You are right.
Yeah, that's a great point.
But we might share this meeting on social media from now on, maybe. I think restricting it to just last week is a bit like we're missing some people because they already made some plans or they already planned another meeting. So sharing it beforehand might be helpful too.
That's also a good point. Well, thank you all for participating and contributing. Hope to see you.
Time to go to sleep. 10 after 1, I've got a 7 o'clock Zoom. So I got to, at my age, I need my 6 hours at least sleep.
Thank you. Thank you very much.
Take care and be safe and well. And again, I just want to underscore what was said, that I know all of our hearts and prayers are with the people in Turkey and Syria. And I know you've lived through this firsthand. So this must be a little bit of PTSD for you, my dear friend. So we look forward to the next, and I appreciate everyone who took time from their day to join this. But I think the one thing we should all commit ourselves to, let's not let it die. This is too important. If it might take work, we might need to restructure it. But to me, the only option that's not acceptable is to say, well, we just can't work it out. We'll put our heads together, we'll figure out, we'll modify it. But as we say on every meeting, the future of psychiatry and mental health and medicine is our students. And this is too important to not figure out a way to make it work somehow.
You are right. It will not end. It will continue.
Absolutely.
And our medical students will be early career psychiatrists or early career physicians.
Right.
But it will continue.
And from a global perspective, we learn from each other globally. So, okay, time to get some shuttle. Have a great day, everybody. Look forward to seeing you soon. Take care.
Thank you. Bye. Thank you for being together.
Thank you for having us.
Bye.
Bye. Ramin, really, you did a great job again.
No, I mean, I just summarized it. Yeah.
Okay, thank you.